Oprah Winfrey says obesity is a disease. What science and doctors say. Media icon Oprah Winfrey has reignited a global conversation about obesity by publicly declaring that obesity is a disease, not simply a matter of willpower or personal failure. Her comments come alongside the release of her new book co-written with Dr. Anya M. Jastreboff, in which she explores her decades-long struggle with weight and how reframing obesity changed her approach to treatment and self-acceptance. Winfrey's argument centers on the idea that biological, genetic and neurological factors, not just diet and exercise, influence why some people gain and struggle to lose weight. She says this realization empowered her to seek medical treatments, including injections of weight loss medications like GLP-1 drugs, and to stop blaming herself for what she now understands as a chronic health condition. Why Oprah says obesity should be called a disease. In her discussions, Winfrey emphasizes that obesity isn't simply about lack of willpower. Instead, she argues it involves brain chemistry, hormones and genetic predispositions that make long-term weight management extraordinarily hard for many people. She has described overeating as a symptom, rather than the cause, of obesity itself, a perspective that reframes how individuals and clinicians approach the condition. Her co-author, Dr. Jastreboff, says the book aims to give a voice to people with obesity and reduce the shame and stigma they often face, similar to how society treats other chronic diseases such as diabetes or hypertension. What medical experts and organizations say. Winfrey's stance aligns with major healthcare bodies in the United States. The American Medical Association, AMA, officially recognized obesity as a disease in 2013, saying it involves complex physiological processes requiring medical care and intervention. The Centers for Disease Control and Prevention, CDC, also considers obesity a serious chronic disease that heightens the risk for conditions like heart disease and type 2 diabetes. Definitions from organizations like the Obesity Medicine Association describe obesity as a chronic, relapsing, multifactorial, neurobehavioral disease that impacts metabolism and overall health. From a clinical perspective, obesity isn't simply excess weight. It's harmful accumulation of fat that interferes with normal body function and contributes to a wide range of health complications. Controversy and debate still remain. Despite growing consensus, not all experts agree completely with labeling obesity as a disease. Some critics argue that the lack of a single, consistent diagnostic criterion and the strong role of lifestyle and environment blur the line between disease and risk factor. They caution that an overly medicalized view could unintentionally shift all responsibility away from individual behavior or promote over-reliance on medication. Others worry that calling obesity a disease might further stigmatize children or people who are overweight but metabolically healthy. The role of medications in treatment. Winfrey's personal journey has also shown a spotlight on GLP-1 medications, a class of drugs that influence appetite and blood sugar regulation and have become more widely used for weight management. While these drugs show promise for many, they don't work for everyone, and doctors emphasize that medications should be combined with lifestyle changes for best outcomes. A broader shift in public perception. Whether one agrees with every nuance of the disease model, Winfrey's advocacy reflects a broader cultural shift. By speaking openly about her experiences, she has helped many people reframe how they think about weight, health, biology, and personal responsibility. The debate continues, but medical definitions and patient narratives increasingly treat obesity as a complex, chronic condition, not simply a matter of willpower or choice.